Hello everyone, it's Pharmaceutical Calculations time with Dr. Dave. This lesson is about medication adherence, and you're going to see medication adherence creeping up a little bit more in computer systems that automatically calculate it, as well as we're looking to inform patients when their medications would need refills to keep up with compliance. And compliance is beneficial for the patient because non-compliance or non-adherence to the way that the medication should be taken, meaning they're missing the dose, they're not taking it as often as they should, or they're taking it less prescribed, and that can be because of several reasons. Sometimes there is money or other type of issues that are going on for the patient, but they sometimes forget, sometimes there's side effects. So understanding what their compliance rate is and for how you can help patients out with that is important. As well, sometimes there are changes to the dosing and the physician or the patient did not make you aware. So let's see how you calculate patient adherence rate. And the way in which we're going to learn to do it is looking at basically day supply and the days since the patient actually came in and got a refill. So let's do an example and I'll show you what I mean by that. So here's a prescription. It's Captopril, 12.5 milligrams. So it's a blood pressure medication. It says to take one tablet by mouth 3 times a day, and you're dispensing 270. Now, in a computer system, typically, which is what we all use now, you're going to enter the drug. You're going to select 12.5 milligrams. You're going to select that it's 3 times a day, and you're going to enter a quantity of 270, and then it's going to ask you, well, how many days supply is that? We should be able to set up a proportion, or some people can do it right off the top of their head, but if you wanted to say that in one day, right? So day supply. So in one day, they're going to take 3 tablets. And if they're getting 270 tablets, right, you would say that this is 90 days, right? This is tabs. Or you can simply just take 270 divided by 3, right? That's what we're doing. So it's a 90-day supply. All right. If the prescription was filled on 8/10/2017, and this patient, Peter Griffin, from Family Guy, looks like. Named Peter came back, he got a refill 110 days later. What was his percent compliance? So looking back at our equations for, looking back at the equation for percent compliance, depending on how you want to word it, you can say that, I like this one because to me it's a little more clear, but I say the number of days supply that the medication is that we gave them, and then this is the number of days since they got their last refill. So meaning the number of days supply of the medication that they got. So this prescription here was for Peter Griffin, and he got 90 days worth. So that's the number on top, 90 days. Right? The number of days that went by so far that he hasn't, or since he picked up the prescription, is 110 days. Right? 110 days. So you have that number times, and then times 100 to get a percent compliance. So if you were to take 90, you divide that by 110, then you multiply that by 100, they're about 81.81% compliant. That's what that's saying, or their adherence rate, we can also say. Adherence rate. So their adherence rate. Either one of those is, sorry for my bad handwriting, but the way in which we calculate this, like I said, sometimes maybe you write a little bit more so even I can read it. Adherence, there we go, rate. Either one, the way you want to say it. Compliance rate, adherence rate. So you can see that the person's about 81.81%. So when you did a refill on somebody or a person who's coming in looking for refills, you can look down and see what their compliance rate is and see that they're 81% compliant, and that might trigger you to ask more questions of the patient. Or in a computer system, you know to call this person because already 110 days went by, you know that they need a refill. Maybe they didn't know that they needed a refill. Let's look at another example of phenytoin suspension here. This is phenytoin suspension. The number 125 per 5 is the concentration. So it's a 125 milligrams in 5 mLs, or 125 per teaspoon. We're supposed to give the patient 100 milligrams 3 times a day, and we're dispensing 240 mLs. I'm asking these in stepwise question. It says, how many mLs will provide the 100 milligram dose? Well, 5 mLs will give us 125 milligrams. Right? If we want 100 milligrams, what will that be? Right? So 5 mLs gives us 125. If I want 100, I've got 4. So 4 mLs will give me 100 milligrams. Right? 4 mLs will give me 100 milligrams. So now we know every single dose. So they are really taking 4 mLs TID. Right? So if you're taking 4 mLs 3 times a day, 4 times 3 is equal to, this is 12 mLs per day, right? So what's the day supply of this prescription? Well, if you're taking in every day, so one day, you're taking 12 mLs. Where did I get 12 mLs from? 4 mLs 3 times a day. And you're getting one day is 12 mLs. Well, if you have 240 mLs, right? You're basically taking 240 and you are dividing that by 12. Right? The number for that is 20 days. Right? So this is a 20-day supply of medication that you're giving the patient. Now the next question is, if the prescription was refilled in 25 days, what would be the percent compliance? So we gave them a 20-day supply. So remember that percent compliance or adherence, however you want to state it, but the percent compliance and percent adherence equals the number that we gave them, 20-day supply, the number of days that it's been since we refilled it, 25 days, right, times 100. In this case, this is about 80%, so 80% compliant. Now, if the days go by, so if they came back and they refilled it on 14 days later and they gave them 20, the percent compliance is not going to make sense in that regard. It's either you're 100% compliant, that you're taking it on 20 days later, right, or you're late on it. But before is just an earlier refill situation. So on calculations for that, we're looking at days, either exactly for the number of days that we were dispensed or days that are afterwards for consent, for percent compliance. Okay, so that's pharmaceutical calculations with medication adherence rate or compliance rate. As always, calculations is the most important class you have because it's the only one that counts.